Most developmental problems in babies are not invisible. The signs are there. Parents see them, they just don't know what they're looking at. A baby who doesn't make eye contact at 8 weeks. A baby who stopped babbling at 7 months. A baby who went quiet after a period of being vocal. These are not personality quirks, they are signals. And the earlier those signals are recognized, the better the outcome. Early intervention in developmental delays, when it begins before age 3, produces significantly better results than intervention that starts later. The brain in the first years of life has a degree of plasticity it will never have again. Acting inside that window matters. In this video, you'll learn 5 developmental red flags in the first year that parents most commonly miss or dismiss, what each one means biologically, and what to do when you see one. If this channel is new to you, subscribe. We publish new videos every week on infant development and behavior based on current scientific evidence. Number 1. No eye contact by 6 to 8 weeks. A healthy newborn is not expected to make sustained eye contact in the first weeks of life. The visual system is immature, and the brain is still learning to orient to faces. By 6 to 8 weeks, that changes. Around 6 weeks, most babies begin to make deliberate, sustained eye contact with caregivers. This is called the social smile window. The same developmental shift that produces the first true smile also produces the first real gaze. These two milestones are linked because they are driven by the same underlying process, the maturation of the social brain circuits that process faces, expressions, and emotional reciprocity. When a baby consistently avoids eye contact, looks through people rather than at them, or does not orient to a familiar face by 8 weeks, this is a signal that warrants attention. It does not confirm a diagnosis. It confirms that the social processing circuitry is not developing on the expected timeline, which can have many causes, some transient, some requiring early intervention. The most important word here is consistently. A baby who sometimes avoids eye contact when overstimulated, tired, or disengaged is behaving normally. A baby who almost never makes eye contact across a range of situations and caregivers is showing a different pattern. What to do? Note the frequency and context. Does the baby make eye contact at all? In which situations? With which caregivers? Bring these observations to the pediatrician at the 2-month visit. Do not wait for the next scheduled appointment if the baby is already past 8 weeks and eye contact has not emerged. Number 2. No social smile by 3 months. The social smile is not a reflex. Reflex smiles, the small facial movements sometimes seen in sleeping newborns, are generated subcortically and require no social input. The social smile is different. It is a cortical response to a social stimulus, a face, a voice, and interaction. It requires the baby to perceive, process, and respond to another person's presence. The typical window for the first social smile is between 6 and 12 weeks. By 3 months, a social smile should be present and reliable, meaning the baby smiles in response to a familiar face or voice consistently, not occasionally. The absence of a social smile by 3 months is one of the most significant red flags in early development. The social smile is a marker of functional connectivity between the visual processing areas, the emotional processing areas, and the motor output system that produces the facial response. When that connectivity is not producing the expected output by 3 months, it indicates a developmental process that is not proceeding on schedule. Research on early autism identification consistently includes the absence or significant delay of the social smile as one of the earliest observable markers. This does not mean that a delayed social smile equals autism. There are many other possible explanations. It means that a delayed social smile is a signal that the social brain circuitry needs to be evaluated. What to do? If your baby has not produced a clear, intentional social smile by 12 weeks, raise it at the next pediatric appointment. If the baby is already past 3 months without a social smile, contact the pediatrician now rather than waiting for the next scheduled visit. Number 3. Loss of skills already acquired. This one is the most urgent on this list. Developmental progress in infancy is not always linear. Babies can have weeks where they seem to plateau or consolidate existing skills before adding new ones. That is normal. What is not normal is losing a skill that was already present and established. Regression in development. A baby who is babbling and stops, who is making eye contact and stops, who is responding to their name and stops, is a clinical red flag regardless of age and regardless of what other skills are still present. The loss of previously acquired skills has a specific term in developmental pediatrics, developmental regression. It is distinct from a plateau and requires prompt evaluation. The most well-documented context for this pattern is autism spectrum disorder, where a subset of children develop typically through the first 12 to 18 months and then undergo a regression in language and social skills. But developmental regression can also indicate neurological events, metabolic conditions, hearing loss, and other medical causes that require different and urgent interventions. The key distinction for parents: a baby who is slow to acquire a new skill is showing a delay. A baby who had a skill and no longer has it is showing a regression. These are different clinical pictures that require different responses. Delay warrants monitoring and evaluation. Regression warrants immediate contact with the pediatrician. What to do? If you notice that your baby has stopped doing something they were doing consistently before, vocalizing, smiling, responding to sound, making eye contact, do not assume it is a phase. Document what you observed, when it was present, and when it disappeared. Contact your pediatrician promptly. Number 4, not responding to sound by 3 to 4 months. Hearing is the sensory system most directly linked to language development. Everything that happens in the first 3 years of language acquisition depends on the baby receiving clear, accurate auditory input. A hearing impairment that is not identified early does not just affect the baby's ability to hear, it reshapes the entire trajectory of language, cognitive, and social development. Newborn hearing screenings are performed at birth in most hospital settings. A past newborn screening is important, but it does not guarantee normal hearing at 3 or 4 months. Some hearing losses are progressive and develop after the newborn period. Others are present at birth but fall below the detection threshold of the newborn screening test. By 3 to 4 months, a baby should consistently startle at loud sounds, quiet in response to a familiar voice, and begin turning their head toward the source of a sound. They should also be producing increasing varieties of vocalization in response to being spoken to, cooing, gurgling, and the early back and forth sounds that precede babbling. A baby who does not startle at loud sounds, who does not orient toward a voice or sound source, or who is not vocalizing in the expected range by 3 to 4 months needs an audiology evaluation. Not a pediatric appointment where hearing is tested with a snap or a rattle, but a formal audiological assessment that can quantify hearing across the full frequency range. What to do? If you have any concern about your baby's response to sound at any age, request an audiology referral. This is not an overreaction. Hearing loss is one of the most common congenital conditions, affecting approximately 1 to 3 per thousand newborns, and early identification is the single most important factor in outcome. Number 5. No babbling by 6 to 7 months. Babbling is not random sound production. It is the brain rehearsing the motor sequences of speech. When a baby produces strings of consonant-vowel combinations, baba, mama, dada, they are activating and coordinating the same motor systems that will later produce words. The acoustic output is practice. The neural wiring being laid down during babbling is the infrastructure of language. Canonical babbling, the reduplicated consonant-vowel strings that are the clearest marker of this stage, typically emerges between 6 and 10 months. Research on language development shows that the onset and quantity of babbling in the first year is one of the strongest early predictors of language outcomes at age 2 and beyond. Babies who babble later, less frequently, or with a more limited consonant inventory tend to show slower language development. By 6 to 7 months, a baby who is not producing any consonant sounds, who is only vocalizing with vowel sounds or is largely quiet, is showing a pattern that warrants evaluation. This can reflect hearing impairment, motor planning differences, or other developmental factors, all of which respond better to early intervention than to watchful waiting. The absence of any babbling by 9 months is a formal developmental red flag recognized by the American Academy of Pediatrics as a reason for immediate referral for speech and language evaluation. What to do? If your baby is not babbling by 6 to 7 months, raise it at the next pediatric visit. If your baby is approaching 9 months without babbling, do not wait for the next scheduled appointment. Request an evaluation now. And regardless of where your baby is in this timeline, talk to them constantly. The quantity and quality of language input in the first year directly affects the quantity and quality of language output in the second and third years. Developmental red flags are not diagnoses. They are signals that the developmental process needs a closer look. Seeing a signal early and acting on it is the most effective thing a parent can do because the brain is most responsive to intervention during exactly the window when these flags appear. The free guide in the description covers all developmental milestones from birth to 12 months. what to expect at each stage, and when to seek professional evaluation. Download it and keep it close. The next video covers the 5 types of baby crying and what each one means, including the ones parents most commonly misread. Watch it next.